Al-Shifa Hospital, the main hospital in Gaza, located in the north of the enclave. Ghassan, really appreciate you taking the time to speak to us. Just give us a sense of what you are seeing in Gaza City and what conditions are like.
So today, it's just to kind of show the fact that the health system has actually started to disintegrate. We were told that the water pressure in the hospital is no longer sufficient to run the sterilization equipment that we use for surgical equipment. And we were given gallons of chemical disinfectants that was being used in the 70s and 80s to start using it to disinfect surgical instruments before we use them on other patients. The hospital is just completely overwhelmed with patients. There, it had a bed capacity of 700, but there are now patients sleeping on the floors, in the corridors, on mattresses, in the emergency department. And the fatigue, both emotional and physical, has already started to have an effect. On the staff. They are no longer able to come in the same numbers as they did before. We've had 14 doctors killed, 13 nurses killed, and a lot of my colleagues have lost family, they've lost their homes. And so it's just absolutely impossible to kind of keep on top of the number of wounded coming in.
And you said it's starting to disintegrate. You said there's about 700 capacity, Ghassan. What's your estimate of how many people now Al-Shifa Hospital?
I think there's double the number of patients as there are beds. I'm in the burns unit, and we have patients sleeping on mattresses in the corridors. Some of them children. In addition to a full bed capacity, been to some of the other wards, and we have patients there. The emergency department is turned half of itself into a kind of ward where patients are either on trolleys or on the floor. And the operative capacity, the operating room capacity is dwindling because of a lack of material and exhaustion of the staff.
Yeah, exhaustion and also not being able to do your job. Let me ask you about water. You said that you are now, in terms of sterilizing equipment, you're using chemical disinfectant. Israel had said, Ghassan, that water had been restored to parts of Gaza, I think, but Gaza officials said they would not be able to confirm this. I mean, what is the situation in terms of water where you are in Al-Shifa?
So yesterday I had a walk around the perimeter of the hospital, and there are queues of people standing in front of water faucets. The quality of the water coming into the taps that we use for personal use has changed. And you can kind of, it's a salty water, which means that they're relying more on the wells rather than on the water supply that used to come in before. So it's obvious that the water is dwindling, and then today's confirmation about the water pressure affecting the sterilization equipment kind of confirms what we've been seeing and feeling in the last couple of days.
And Ghassan, I know that Israel had asked people in the north and in the city of Gaza to move south. Some healthcare facilities say they can't comply, saying it's basically a death sentence. Are the majority, those who can, are they moving? What about the rest? What can you do for those who cannot move? How concerned are you?
I mean, Gaza, as you well know, Gaza is the world's most densely populated place. And a land invasion will lead to absolute carnage. I mean, there's no way around this. A decision to invade Gaza is a decision to create civilian casualties on a scale not seen in the Middle East before. Anybody who's been to Gaza, who's seen the overpopulation in Gaza, can attest to that. Certainly, the hospitals will not be evacuated. As health professionals, our commitment is to our patients first and foremost. We are here to advocate for them. We are here to defend their right to life. And we will certainly not be evacuating because most of our patients cannot evacuate. Blast injuries induce multiple injuries in multiple systems. Even the less wounded ones have multiple fractures in a lot of their limbs.
It's a very incredibly dire picture, catastrophic picture you are painting. Can I ask very briefly, Ghassan, how you're doing, how you're coping?
Just tired. We're on kind of 4 or 5 hours sleep. We finished operating yesterday at 2 o'clock in the morning. We've been going since this morning. We still have one surgery to do. We've already done 10 cases. And it's like that, and it's unending, and we, even as a one department in a large surgical hospital, we have over 100 patients that are still waiting for surgery. And we are operating at maximum capacity, and we're still haven't, been able to do that. And what we're noticing now is that delay in getting patients to surgery means that wounds are showing up infected, pouring with pus, because what distinguishes blast injury wounds is the amount of contamination there is. That's why these patients need to be getting to surgery to be cleaned and debrided and properly treated, and that's just not happening. The limited capacity in the operating rooms is going to those with life-threatening injuries.
Ghassan, stay safe. Thank you for all your work. Thank you for all you do. We'll keep in touch with you. Ghassan Abu-Sittah, the surgeon, Al-Shifa Hospital in Gaza, painting an incredibly dire picture of what is happening inside that hospital. We're going to take a short break. I'll be back after this.